Dear doctor, do we like getting reviewed, getting 3 stars, 5 stars, 1 star, and whatnot? I'm sure not all of us agree and like being reviewed. But do we have a solution? Not really. So, how can we deal with reviews better? Specifically, Google reviews. Here are the top 5 tips that you can use in your practice and to manage your Google listing and manage your Google reviews more effectively. Trust me when I say this, in my interaction with so many doctors, unanimously, all of them have at least asked me once what to do about a negative Google review. Whether it is genuinely your fault or not, we all have landed up with one such random 1-star review where either the patient has just randomly called, is not even actually a patient. They've called for something sometimes at 11 o'clock in the night and you've said you're not available, and bam, the next thing you get a notification that you've got a 1-star review on Google. Many such things happen. Why do they happen? Let's understand that first. It's not just that they're treating the doctor as a commodity. Sometimes the reviews also pertain to the clinic location, the lighting of the clinic, the hygiene in the clinic, the behavior of the staff, the accessibility of the doctor, and the waiting hours, and a lot of other things apart from just the doctor's skill at being able to treat or elevate the problem that the patient had. So we must consider all of these in mind when we manage the reviews that we have received from Google. Number 1, correct what can be corrected. We must be open to criticism. If there is something from the experience or the process of the clinic, of the consultation of the staff that can be corrected, then we must take proactive steps to do the same. But while we do that, point number 2, please make sure you reply even to the negative review on Google with a very polite and formal message, either accepting the flaw or explaining why it might be a difference of perception, or ensuring that you are committed to improving the same. This leaves an overall positive impact for someone who might be reading that review much later, because it shows that you have been proactive at correcting it. Number 3, to correct or balance the 1-star review which has suddenly brought down your rating from 4.5 to 3.3 or 3.5, do not try to pump in with fake reviews or do not try to buy reviews. Google has policies that are reviewed and updated every few months, and suddenly you'll find yourself wiped off these reviews. Something similar has started happening on Amazon very recently, so it does not serve well in the long run. Don't opt for that. Number 4, don't ask friends or family to purposely post something there, because there are Google policies in place and it is not too difficult for even a layman to detect if the person who's posting is in any way related to you. Often just the username gives it right away. So let's refrain from that. That brings us to number 5. How do you actually get genuine reviews? By creating a dedicated channel and not chasing the reviews with your patient, but making sure your patients know that such an option exists, by giving them a dedicated channel where they can post a review if they wish to. And that brings me to the end of this video, where we answer the question, what do you do about a negative review? You can flag a review and report it to Google for a review of the review, and if it violates any of Google's policies, whether it is harassment, whether it is spam, whether it is misleading content, whether it is something that is erroneously written there, Google does allow a one-time appeal that you can submit and have that review completely removed from your profile. This might seem tough, but if you refer to our previous video, unless you have actually claimed your own Google profile and are in charge of managing it, you will not be able to do this smoothly, as Google will request some kind of identity proof from your end when you flag a review. Pro tip, having a Google local guide who's ranked high to help you with such a flag is very useful, or you could become one of those local Google guides.